Just yesterday that we told you about a man who died in Kalaburgi was due to COVID-19, and now Delhi has registered its first death from the deadly novel coronavirus. A 68-year-old woman has died due to coronavirus infection at Delhi's Ram Manohar Lohia Hospital, the national capital, and this is the second death in India, and it is linked to the global pandemic in the country. Now, the Delhi woman was a resident of Janakpuri in West Delhi, and she was infected from her 46-year-old son, who had recently traveled to Japan, Geneva and Italy. And the son is also being treated for COVID-19 at RML Hospital, and the deceased woman also had diabetes and hypertension, which all mounted together and succumbed to her ailments now. This is the sixth case of coronavirus to be reported in the national capital, and other conditions including high blood pressure and diabetes. Now, her death comes on a day when the number of cases in India rose to 85, including a 76-year-old man who died in Karnataka on Thursday. Well, this is the second death that is reported in India due to COVID-19, and the number of positive cases in India rose to 85 today. And this is clearly a shocking development in the country, and the health departments and the health authorities across the country are taking all necessary and precautionary measures to avoid further spread of the infection and further going on to claim lives across the country. In Karnataka, it was a 76-year-old man who died just a couple of days back, and yesterday we told you that he died due to COVID-19, and that was the first death reported in the country due to COVID-19. And now, close on the heels of the first death, another woman succumbed to COVID-19, and this time from the national capital, which was the first to be locked down. Now, for more on this, I'm being joined in by my colleague Suraj. And Suraj, this is the second case that is reported in the country and the first one in the national capital. And also, this is the second case where an elderly person has died. So what more do you have on this?
Deepak, it is shocking that this incident has come to light here. The government of India has in fact released an entire document with respect to what exactly has happened, and they have also gone ahead and given a complete detail with respect to this particular death here. Let's just take our viewers through what exactly has happened. She's a 68-year-old female from West Delhi. She was a mother for her son. Her son had traveled to Switzerland and Italy between 5th and 22nd of February. So between 5th and 22nd of February, he had visited Switzerland and Italy. He returned on 23rd of February. After that, they have gone ahead. He tested positive for COVID-19 because she is a primary contact here. The COVID-19 had spread to her as well. She was also being treated for the same. To be very honest, as per this, he initially was asymptomatic. That is, he did not show any symptoms as soon as he returned from Italy as well as Switzerland. But he started developing fever and cough, is what they have said, after one day, and he reported to the RML Hospital on 7th of March. So between 23rd of February and 7th of March is when he had developed symptoms for COVID-19. So probably 23rd he returned to India, and after which possibly for another 7 days, for a week, probably he didn't have anything, but then he started developing fever and cough. So on 7th of March is when it intensified, and then he admitted himself to the RML hospital. And as per protocol, the family was also screened because they have primary contact here. So that is when they understood that the mother also had fever and she also had cough, cold, everything. So that is why both of them were tested for COVID-19, and the reports showed that both of them were positive. So they were under isolation, that is 14 days isolation. He was asymptomatic first, then he was symptomatic. Even the mother was asymptomatic, but she was symptomatic. So that goes ahead and shows, as per protocol, 14 days will be the first period where they will be monitored. The next 14 days will be to see whether they are recuperating, whether they are actually responding to the treatment that is being given to them. So after that, To give a background, the mother sample was collected. That is a 68-year-old woman. Her sample was collected on 8th of March. His sample was on 7th. Her sample was collected on 8th of March. Not to forget. Most of these instances, because all of them are elderly person, they will have age-related ailments as well. So here in particular, she had diabetes and hypertension is what we are learning. So hypertension, diabetes, weird combination here. Even the 76-year-old man who was present, even he had hypertension, BP, asthma, he had pneumonia, all of that. So somewhere the age-related ailments adds on to the COVID-19. The immune system will be quite weak, so the body cannot combat the virus. That is one of the possibilities why aged people are succumbing to the virus here. So on 8th of March her sample was collected and her condition started deteriorating from 9th of March. So 9th of March is when her condition started deteriorating, and she was shifted to the intensive care unit. So she was being monitored and her sample also tested positive. So since 9th of March she was having respiratory fluctuations. There are possibilities that the water, the lungs will be filled with water. That is when they will be having breathlessness as well. So from 9th of March she had respiratory fluctuations, and then she also had she was on ventilator for quite some time now. For almost 4 days she was on ventilator, and due to comorbid conditions, that is because it was aggravating and because there were several conditions which were acting together on her body, she died on 13th March 2020, that is today, at RML hospital, and it is in Delhi, and it is confirmed by the physician as well as the medical observer who's present there. They have confirmed this particular case, so that shows this is the entire timeline what exactly had happened. Now all precautionary measures have been taken is what they have said as per protocol, including screening, quarantine of the contacts, which has already been made by the Ministry of Health and the government of Delhi as well. So they are monitoring all of the primary contacts, secondary contacts and tertiary contacts at this point in time. That is very important. They will have to screen them. Contact tracing is something which they will have to do. Whom was the son in contact with, and who all has he spoken to, the cab drivers, the auto drivers, from all the way from the airport to their house. Have they interacted with any of the relatives? Has the mother interacted with any of the relatives? All of this is what they're doing. Contact tracing is what the government of India as well as the government of Delhi as well as the Ministry of Health, all of them working together trying to identify what exactly has happened. So several procedures being followed here, but tragic that the second case has been reported in India, Deepak.